me for something to do.
Okay, ready when you are.
Okay, we are calling to order the Strategic Planning Committee meeting for the Fallbrook Regional Health District on July 15th at 5:34. Call the meeting to order, roll call.
Well, we don't need a roll call because you're both here, nobody's online, so you're both here.
Okay, we're both here, just following the cue here.
Yep,
And then no public comments to
Yep,
speak of.
and we didn't receive anything via email and there's no one else on Zoom.
Cool. Well, I'm really excited to see the SOAN timeline.
Yeah, so I've reached out to them. They have not registered with the California State Secretary to do business. So
Okay.
Alex has required that they file for that. They're like, no problem, no big deal. So that should probably be done. Their main contact, Sophie, and I both are out next week. Well, I'm remote, but she's out. So the main business partner is doing that filing. When she gets back on the week of the 27th, I'll get back. We'll look at calendars to set that first phase.
Mm-hmm.
But if you look at the SOAN timeline, they have like that first 1 to 2 meetings being kind of maybe either ad hoc or just staff. So we'll talk and see what meetings we can set up with that. Those first couple of meetings are more like getting expectations in realistic, voice to voice. We had the written RFP, obviously, but just really clarifying, this is what we want so that they understand. The timeline originally was that we would have had them start in July and be able to finish in February. They'll be starting in August, so we're gonna push that to March.
Yeah.
Which is still fine.
Yeah.
That gives us opportunity for, oh, nice.
Yes, I put that up for you. Thank you.
That'll give us opportunity to have their report in hand before I finish budgeting, which will give us good opportunity to make sure that if there's recommendations in there, that they can get budgeted for the 27-28 fiscal year. So I'm not too concerned about the timeline. I spent a couple hours yesterday in a meeting with Teresa and Jasmine. We're gonna put together a marketing foundation plan that is a 12-month rolling, so that we can then take those marketing pillars and use that as guidance with SOAN, so that we're following in line and aligning not only their stuff, but our programs and our marketing so that we're more consistent going forward.
And when you say marketing foundation, you don't mean the foundation, you mean the foundation of marketing.
Correct.
And just
Right.
we have 2 F's. We have
Right, I may need to
foundation.
go in and change that on the document,
Yeah.
because as soon as I put that, I'm all, oh, they're gonna seem confusing.
Well, they could, I'm just saying.
Right,
Yeah.
but like our marketing base,
Got it.
we'll come up with something.
Okay, very good.
So the timeline is set, they're ready to contract with us. I've already outlined the agreement on our form. I sent that over to Alex. Once we get their registration from the state, we'll plop that in and then we'll be ready for signatures and stuff. The board has already approved it via the minutes and such, so I'll be able to sign that contract. And then Alex does the attestation basically for it, and we'll be good to go.
Cool.
So
Very good. That's
it's ready.
very exciting. Very, very exciting. I'm glad that it all worked out swell.
Yep.
Okay. Now moving on to the big picture of strategic priorities with the little tiny print.
Oh, yeah. So, well, this is, yeah, this document was the one that we created for fiscal year 25-26 that had strategic priorities. Again, it was much more focused than I think we'll start going in the future because it had specific programs, facilities. In the going forward, we're probably gonna wanna look for longer phase as some of the construction need projects no longer take up quite as much energy.
Right.
And now that a lot of the programming is more solid, and we may not want to project too much on project programming until after sewing
Right,
completes.
Right, no, I agree, I think we want to put a parentheses.
Yeah.
And just say we're steady. And then when we get that new information in March, we can swing into action. I don't see doing double planning, do you?
Yeah. So for the goal setting for fiscal year 26-27, which is the one we've just started, to update what our priorities are, I wanted to bring to this committee first to see if there was anything. There will be new stuff under facilities, which is pretty much building A, room 1 and 2.
Yep.
There's probably a couple other things I'll bring to facilities committee, but I'll wait on those. LAFCO will continue to just sit there as it does. Clinical services will continue to sit there. I did have a meeting with that potential partner yesterday. We are trying to coordinate some schedules, and we're looking at maybe the first pseudo ad hoc meeting, maybe August 6th or 7th, that's a Thursday, Friday. I didn't check with you, Jennifer, on your schedule, but I am gonna try and also make sure I get Sally's schedule.
Yeah, I'll check my schedule on my phone.
Okay, I figured this very first meeting, you're already more familiar with a lot of these conversations, so if you couldn't make it, it wouldn't be, I don't think, dramatic, but Sally needs to get onboarded pretty fast, especially
agree.
since
I
you're
agree.
gonna come
Be
off
leaving.
and she's
Yep.
gonna,
And Albert's leaving.
right,
Yeah,
which
no,
means,
that's the right call. I hope I can be there though.
okay. Once I get confirmation that their team could make it, then, from staff side, it was gonna be, Teresa and myself. And then obviously whomever on board side. And what that should do is give us the opportunity for that first ad hoc meeting to just be like, okay, let's get in the room. What are we talking about? We know, and I'm taking this from previous meetings, that we are saying we must have imaging and we must have labs. It won't be imaging probably as far as MRIs,
No, we
but
at the level up to.
up to.
We're not gonna have a CT scan or a
Right.
MRI. No.
Right, the idea of real urgent cares
Yeah.
typically have at least X-ray. And so I brought that up in the conversation yesterday with Jason Broad, and he said, yes, that's completely understandable. Still looking at whether or not that space is still available down in Bonsall and a few other things. They're gonna bring in a different strategy and business person within their hierarchy. So it's a slow gradual,
That's
which
good.
is why I will keep it as a strategic priority and update timelines as I get more information.
Perfect.
What I will pretty much probably take off is program development, because those programs keep changing left and right.
Yeah.
But I may put on there, this marketing plan, because it's gonna be a significant change for the district. We're gonna be upgrading the website, we're getting away from Streamline.
Oh, good.
That solves that
You had a
PDF.
breakthrough?
Yeah, we found a different entity that can handle all the PDFs that go on the website. So remember, the history on that was a law was passed that said any PDF that's on your website must be fully ADA compliant. Well, we have like, I forget what they said, like 3,000 PDFs or something on our website. A lot of them are historical, way long. So we figured we could clean a lot of it up, but Streamline, the cost for their doc access, which is this tool
Yeah, you told us about that. So,
Yeah.
well, good. Thank you for bird dogging that
yeah,
and
so
getting us out of that mess.
we'll get the website, these new marketing-based foundation language and process, which you'll hear a little bit more about when we do government and public engagement. That'll overlap with this, but that is gonna be a good chunk of time from Jasmine, Teresa, myself. That'll take a fair amount of time. So that'll be a strategic task for this fiscal year, even though in the long run, it'll be something that falls off.
Yeah, well, that's the way plans are.
Right. But it's just a 1 year, which I think is appropriate with all the other things we have going on.
I agree. Does that sound good to you?
Yes.
Okay. Good thinking and good progress and goodness all around.
We're getting there. And then the only other thing I have, is that I am starting to work on, and I'm dragging Jess with me as we train her up in HR. It's time to update the employee manual. It's now 2.5 years old. Plus we'll have Alex. So we're gonna update that. Again, that'll be a shorter admin related project. But as far as strategic priorities for the district, I need your.
Yes. You need our input about it being a priority.
Or you telling me what priorities I may have missed. What are the things the
Oh, you
district
mean
should be working?
in addition to what you just.
Yeah, in addition to
presented?
what, yeah, no.
Uh,
In case you guys have anything you think I
That
missed.
we should put on the horizon line and say, you need to watch that. That we're not already doing.
On the employee manual?
No, big picture.
Oh,
Yeah, so employee manual and marketing are two things I'm gonna add. The program development I'm gonna take off because we're gonna wait for Sowen for that.
yeah.
Facilities will be on there, we'll just change what those tasks are because they're still rolling. Clinical services will stay because it's still rolling.
Mhm.
But in case there is another larger priority,
I don't think so. I feel like we're pretty set on a lot.
Yeah,
I mean,
it's a lot.
it's,
The plate's full.
I felt so,
Yeah.
but I.
Thank
you for asking.
You're the board that sets strategic priorities, so I didn't want to just not ask.
Thank you for asking. And I think
It's a lot.
it's a lot. It's the right mix, it's the right level, it's all of that.
Okay, does this reporting tool work well enough for you from a snapshot standpoint?
Yeah.
Mhm.
Because I figured I can bring it to our meeting every other month,
Mhm.
so that if and when there's movement on projects, you can see if we've gone to, committee, if it's going to board, so on and so forth. I might change up some of the colors, so it's a little easier to see.
Yeah. No, that makes sense, and the call letters help you to know, to draw our attention, so that's good.
Yeah, I like it.
Mhm.
Okay, good. Yeah. I mean,
Okay,
it's because we're wrapping up obviously fiscal year end.
exactly.
We had a good fiscal year. We will have, and this isn't really gonna be a strategic priority, but it's something that Raquel and I have talked about with 2, potentially 3 new board members coming on. We're gonna be updating our onboarding for new board members. And then Alex had an idea about how to do training. So instead of, trying to sit through everything super long every single
Yeah.
time, he's gonna bring that forward to each of our meetings. So
Okay.
that the new board can get a little bit of training at every single meeting.
Oh, that's a good idea.
Oh.
Bite sizes.
Yeah.
Anything that's essential can be loaded up front and then
Right,
like a good meal.
right. There's just been enough going on at the legislature that we wanna make sure that changes that come forward are done.
Yeah.
A little more commonly. And then, our board meetings are so fast that we're thinking, and
We would say efficient
they're very,
and effective.
They are.
they're
I appreciate them.
Yes.
They're very much that, but I do think, especially as there's still so much happening with program development, that I'm gonna bring both mine and Teresa's board reports out of consent and into
I
discussion.
like it. I think it's important for the public to hear. The
And,
public.
right, I mean, we don't know who's watching the
True.
YouTube later.
Yeah. Yep. Oh, God. Somebody's, they need a little counseling if somebody's watching us.
Listen,
But anyway, they
Somebody
might
might be interested.
No, but it's kind of like the treasurer's report. It needs to be explicit. And I like the idea of the larger amount of exposure.
Yeah.
For the detailed work we're doing.
And neither Teresa or I have really extensive reports that we're drawn on. And Teresa is working to change her report less of these static numbers that made sense when we were in program development and more about programs that are in works.
Yeah.
Ideas that are coming forward so that you can stay involved in the development of those things. So that as someone comes to us periodically to report to the board, you can be like, oh yeah, we talked about that programming or we talked about that initiative, whatever.
Yeah.
So that's not really a strategic, but it's the best place to bring it forward.
Yeah.
So those are some changes that I imagine coming for the 26-27 fiscal year.
Excellent. What board member comment or future agenda item do you have?
Nothing for me. I'm pretty sure probably gonna be getting updates on stuff for the next couple of meetings. If we hear anything.
Pretty much.
There's a lot going on, so.
There's a lot going on. So we'll bring that to board meetings as far as programs, projects, whatever. Right now, facilities is still probably the most active committee besides finance, which we do every month because that's always happening. But facilities is the one that's still moving the most as we start to really focus on building A. Those will be conversations that come forward. Henry and Juliana over there are doing a great job with their planning. They are also building out a 12-month rolling set of programming so that the programming and the marketing are much more in sync and less of our marketing will be like event, flyer. But it will be tailored more toward outcomes. We focus on these things. We focus on these things. These are the programs that address that. So it'll be more about mental health. And then in mental health, we can talk about mindfulness, stress, so on and so forth.
Yeah.
Right.
Good.
So we're shifting away from that one format into this other format. And I think that'll be better at the board conversation level too.
Yeah, putting light together is always good.
It just makes more.
And it's time. We've developed enough, thank you very much, that we have packets.
Yes.
Yeah.
Yes.
Good. Okay, I have no future agenda items and I only have 2 of these meetings left.
I know. We know.
September and November. Yeah, it goes by fast, huh? Did your
I thought it was just like a couple months that I was in here, and I'm like, dang, it's already been a year.
Yeah, don't forget, you actually have to, run for the board this
I
year.
know.
I'll be sending you the paperwork soon.
Okay.
Yeah.
Probably in the next week or so.
Did you get that just this week from the registrar? Was that this week?
They
Yeah.
just they open.
I think it's mid-August.
Oh, the due date?
No, the
Is-
due date
the
is
due
in
date
August.
The
is
due
on-
date is mid-August.
It's either the 12th of
Yeah.
August.
Yeah.
I'm going through the same thing for Palomar, as you know.
It's been a while.
I know.
And I was uncontested the last time.
I know.
You were? Oh,
Yes,
wonderful.
I didn't have to do anything.
Wonderful.
As soon as it closed.
That's such a relief.
It
isn't
is, but it's just pull the papers and done.
You know
That's
what?
awesome.
We want that too, because that means then the district doesn't have to pay the county
Exactly.
for the votes.
Exactly.
We don't have to pay to have the election done. And that's $40,000.
Well, we have 3 seats.
Yeah. Are you in touch with Anne?
I have spoken with Ann already, yes.
Okay.
So, hopefully community members will be speaking to her to remind her that she has to file that. We're not allowed to reach out to her.
Right. I'll call the people who do that.
Okay, perfect. Hopefully we have no contests,
Yeah.
which will be great. The only thing we may have to consider is if Annabelle wins her seat at the elementary school district board, then in January, we would have to appoint someone from zone 2 to fill her seat. Then we would actually have all 3.
Yeah.
Because if she doesn't win that seat, she's agreed to stay on the board.
Oh, okay.
Good news, bad news.
Yeah.
Yeah.
Good news, good news.
Yeah, I mean, for us,
Yeah.
we'll be happy if she gets what she wants,
Absolutely.
and we'll be happy if we get her to stay.
Absolutely.
Yeah.
So,
That's a bit of a jigsaw puzzle.
that's it.
Okay, well, hearing no other comments or future agenda items, I will declare this meeting adjourned.
Excellent, thank you. And your ride has arrived.
Yeah, we gotta go to the men's warehouse, but we have a wedding.